Here's my infant. There's no markings, none of that. Okay, I'm going to assess the infant's head. As I assess the infant's head, I can see that there's no caput succedaneum. There's no cephalohematoma present. There's also no molding. There's no bruising, monitor marks, or skin tags on the infant's head. Here is the anterior fontanelle. It is diamond shaped, 2 to 3 centimeters, and there is no bulging. Back here we have the posterior fontanelle, and it is triangular shape, 1 to 2 centimeters, no bulging. Here we have the frontal suture, then we have the coronal suture, the sagittal suture, and then the lambdoidal suture. As I look at the infant's ears, the pinna is well formed. The eyes are both symmetrical and they're level to the ears. The pupils are equal, round, and reactive, and then there is no sacral hemorrhage. Both of the nares are patent, and the septum is midline. I'm going to use the pad of my finger, and I'm going to check the infant's palate. I can see that the tongue is pink and moist. There's no Epstein pearls or prostitious teeth. The infant is not tongue-tied. And then there's a little bit of cyanosis around the mouth. When I look at the infant's face, I can see that there's a little bit of milia present. There's no nevus, and there's no skin tags. Now I'm going to assess the infant's neck. I'm going to palpate the lymph nodes. Then there's also no webbing, and for the infant's clavicle, it is smooth, straight, curved, and intact. The infant's nipple bud size is 1.5 centimeters. There's no witch's milk. And then I'm going to inspect and palpate the precordium. As I look at the infant's abdomen, there's no protruding and there's no bulging. And then I can see that the umbilical cord has 2 arteries and 1 vein. Now I'm going to pull the infant's arms down to the side. I can see that both the arms are equal in length. There's no polydactyly or syndactyly, and then there's no Semenian crease present. I'm going to check the infant's brachial pulses, and they're both equal bilaterally. And then the cap refill on the infant's fingernails is less than 2 seconds. Now for the female genitalia, the labia majora covers the labia minora and the clitoris. I can see that the hymen is present in the smegma. There's no vernix or pseudomensis, and then I'm going to also feel for the infant's femoral pulses, and they're both equal bilaterally. Now for the male genitalia, the testes is in the upper scrotum. There's rugae on the anterior scrotum. This infant is circumcised. There is also no hydrocele or epispatus or hydrospatus present. And then I'm also going to feel for the infant's femoral pulses to check that they're equal bilaterally. Now moving on to the infant's legs and feet, I'm going to do the Babinski reflex. So I'm going to stroke the sole to the outer side of the foot to the toe. The toes are going to dorsiflex, and then for the plantar reflex, the toes would curl inward. Now I'm going to do the Orlani's maneuver, so that's going to be abducting and deducting the infant's hips. So I'm going to do that. Now I'm going to do the Barlow's maneuver, so I'm going to keep one of the infant's legs straight, and then I'm going to bring this one up to the infant's abdomen, and then I'm also going to do the other side as well. Now, and there's also no polydactyly or syndactyly on the legs and feet. Now I'm going to flip the infant over. I'm going to inspect and palpate the infant's spine. It's curved and intact. There's no predonal dimples or hairy tuft. The infant's bottom, both of the creases are equal. The anus is patent, and I don't see any Mangolian spots. Now I'm going to assess the infant's skin overall. There is no vernix present or lanugo or bruising, and then there is also no drying or peeling of the infant's skin. There's also no stork bites, pork wine stains, or strawberry marks, or there's also no erythema toxicium present on the infant as well. Now I'm going to move on to the infant's reflexes. When I assessed the infant's mouth, the infant was able to suck, so the sucking reflex is present. Now I'm going to do the rooting reflex. I'm going to gently touch the infant's cheek near the mouth. The rooting reflex is present. I'm going to do the Moro reflex, so I'm going to lift up the infant's arms and then I'm going to gently drop them. For the grasping reflex, I'm going to place my fingers in the infant's hands, and then if the grasping reflex is present, the infant will grasp my finger. Now I am going to move on, and I'm going to flip the infant over. And for the ventral suspension, the infant's head would stay horizontal. For the trunk incurvation, I'm going to gently touch or stroke one side of the infant's back. And the side that is stimulated, the infant is going to laterally flex towards that side that is stimulated. Now I'm going to flip the infant over, and I'm going to do the tonic neck reflex. So I would place the infant on its back, and then I would move the infant's head to one side, and then the side that the infant is facing, the arms and the legs will expand, and then the opposite side will flex, and then the other side as well. So if I move the infant's head this way, this side of the infant would be expanded or extend, and then this side would be flexed. Now I'm going to do the head lag reflex. So I'm going to lift the infant up like this, and then the infant's head would drape. And then lastly, the stepping reflex, I would pick the infant up and I would touch the feet on whatever surface, and if the stepping reflex was present, the infant would like lift up its feet as if it was walking, or yeah. So that is it.